Hello, today I'm going to do a video about do folate in female and male patients. So I'm going to start doing for male patient. So first I need to review the patient's record and see the order. I need to see if there is any restriction, and I need to get my equipment that's sterile and disclose my equipment. So I'm going to the room. I need a working table that's my waist high, and I'm going to do hand hygiene before starting to talk to my patient. So I need to check the name and date of birth. So sir, can you please tell me your name and date of birth? Okay, he told me and matched. I need to check here on the wristband. So now I need to close my curtains. So close my curtains. And now I need to assess my patient. So first I need to put the bed higher so it's comfortable for me to work. It's higher. I'm going also raise a little bit more. And now I need to start working with my patient. So I need to clean the perineal area first before I insert the catheter, the folate. So I need to put the clean gloves. So I have done my hand hygiene. Oh, and I forgot to say, but when I'm doing hand hygiene, you cannot have any rings that is not a band. So in the case, mine is a band ring, so I can stay with it. But normally, you need to remove your rings and anything that can cause cross-contamination. So okay, so now I'm going to remove the blanket from my patient. Make sure he's not exposed too much. So I'm going to remove it here. I'm going to ask my patient to move his leg up so I can work better. So you normally ask the patient to do, but in this case I have a mannequin, so I need to do for my patient the whole thing. And it's hard. Okay, so I cover a little my patient here, and I need to get my wash bath thing. So I need to clean my patient perineal area, so I get here. And I'm going to expose my patient again. And I need to clean. So I get one, and I clean like this, and throw. Get another one, you go clean, and throw, and clean again, and keep going until it's all clean. So you make sure that has no fizzes or any other dirty. So you cover the patient again, and you remove your gloves. So you remove your gloves and you perform hand hygiene again. So now I need to open my sterile field. So get a table and get a garbage close to you. And make sure your sterile field is like beside you, or make sure that you're not going to be behind. Not going behind you. So okay, my package is closed, is sterile, is provided for my facility. So I'm going to open, and many people use this bag as the garbage in case. So I'm going to just use this one here to put my garbage, and I'm going to remove before I do my gloves here. So I'm going to just put my garbage here, and I'm going to open my package. So open the far way first, the sides. Make sure you're not touching too much, and you can just touch the outside here. Make sure it's not coming back. First, I'm going to do my gloves, my sterile gloves. Make sure you don't touch anything for your sterile field, and see that it's on my side. So I'm going to get my other working table here, and I'm going to open my gloves. So make sure you're not touching the sterile gloves. Sorry guys, this package is old, and the glove is not collaborating. So make sure you're not touching or don't go back. Okay. So I need to get, and make sure you touch only 1 inch outside. Sorry guys, my gloves are ripping. So I have provided hand hygiene. So I'm going to get my non-dominant gloves and get my dominant gloves. So get it outside. And check where is your thumb. So my thumb is here. So I'm going to start my gloves. And make sure you're not touching any unsterile thing. And if it's wrong, you can keep a little like this and you do later on. So if you're sterile gloves, you're going to get the sterile gloves. Make sure you're not just touching the sterile part. And here, and you can throw this away. And make sure you know where's your thumb. So you can put here. So now you can fix your gloves. So you can go and make sure you're not touching your wrist. So in this case I need to fix my gloves here. Make sure your thumb is not going contaminated. So okay, have my sterile gloves. So I'm going to put this table up. Bring him. So I'm going to get my drape, the blue first, and the shine UV on the bed. So to put on my patient, so I'm going to go like this so I don't contaminate anything, and make sure you're not contaminate here. So I'm going to put on the patient. So normally you ask the patient to go a little up, but I have a mannequin, cannot do it here. And I have another one here, a white drape, that is to give me more working space area. So here, make sure I'm not touching anything. So now I can get my work field move up there. So I can put here, making sure you're not contaminating it. So I can work in this area here. So it's everything in my sterile area. And first, I can use this one here, I don't know the name anymore, to give a better working area. So I'm going to put it on the patient. So it's also extra sterile area for me. And I need to open all my supplies. Oh, and make sure you ask the patient if he have iodine allergies or latex because of the folate. And normally the hospital use iodine or hydrogen peroxide. So in this case, I'm not going to use iodine because it's a mannequin and it's going to stay in there. So you just open, put on your cottons, and you throw away. And also you can open your lubricant and put a little in your tray. So I'm going to put here a little by tray and throw away. And make sure your folate is closed. And if it's attached, write everything. So mine is closed. Make sure you need any specimen, so we don't need it any here right now. So okay, I have cleaned, and I'm going to start cleaning before I insert the folate, but you need to check the folate here. So make sure you remove the folate and don't touch the tip of the folate. So here, and you can put on the lubricant. So I'm going to do the lubricant, and I'm going to leave here my tray because it's already it is the area of my tray. And also they have the normal saline that I'm going to use. So I'm going to let it open here, and I'm going to clean. So I'm going to get in my non-dominant hand. I'm going to hold the penis a little higher, and my cotton has iodine. So I'm going to clean and throw. Get another cotton. Going to clean and go back to me and throw, because if I do like this, I'm going to contaminate my area, my sterile field. So I'm going to clean and throw, and I'm going to clean and throw, clean and throw. So okay, this hand is contaminated, it's not sterile anymore, and I'm going to start inserting my folate that has lubricant here. So I'm going to start inserting. And make sure my patient's not feeling any pain, and if he feel any discomfort. So in case you feel like it's not going, you can just like go around. And you need to insert the folate onto the bifurcation. So my mannequin don't allow me here. So I get my syringe, and I need to insert here my syringe with my sterile hand. and I need to insert my normal saline. So I insert, and after you insert the normal saline, it's going to make a ball inside, and you can just remove your syringe, and you pull a little to see if there is a resistance from the foley, and it is, so it's in place. So I can get my thing here out of the patient and attach to the bed. So I can, this I need to wrap. I literally just cut it, but in this case I'm just making a video to train, and since for stud purpose I'm not going to break this now, and I'm going to remove all my things here, and I'm going to remove my sterile gloves. I'm going to remove my sterile gloves here. Sorry, these gloves are old and strobe. And I'm going to put the patient back in the position. And my tube is here attached to the bed. And I just asked if the patient needs anything else, and that's it. So now I'm going to insert the following the female. So I need to check the patient, I need to check medical records, so date of birth and etc. And I need to put the bed up, work level. That normal is my waist level. Okay, so first I need to put clean gloves on. So put clean gloves. And I'm going to remove the blanks from my patient, make sure I don't expose too much. And now I need to clean. So I have a bath wipers, so I'm going to get one, and I'm going to clean, throw, get another one, clean, throw, and make sure it's everything clean, so throw. So I clean everything here. I fold back. I'm going to remove my gloves. And now I'm going to do hand hygiene. Okay, so now I need to start my sterile field. So first, when you open it, this for my facility, it's closed and it's sterile. Before I open my sterile field, I need to remove the blank so I don't contaminate it, and I need to put her legs up in a fold. Okay, yeah. So okay, now I can open my sterile. It's sterile, and so now I'm going to open it. So I open the third one, the side ones, and just touching the outside here. So I have here. So the first thing I'm going to do is my gloves, my sterile gloves. Make sure you don't touch anything there, and yeah, there's something to be beside you for your sterile gloves. So I'm going to open my sterile gloves. So now I'm going to open my gloves, get my non-dominant, and I just touch the outside and check where is my thumb. So I insert my gloves. So I insert my gloves. So I insert my gloves and I get it here. My other one, just touching the sterile part. So here, I throw this, and I put my gloves on. So now I can fix my gloves. So just touching sterile if it's sterile. And I don't know what happened here. So I got really messed up wearing my gloves. But the important thing is I'm just touching sterile with sterile, so I'm not contaminating my gloves. And I can fix it. It's gonna take a while, but I'm not contaminating my gloves. So now I'm going to start my sterile procedure. So I'm going to get my drape. So the shiny UV to the back. So make sure like I'm covering so I don't contaminate anything with my gloves. And I get the blue, also the shiny part in the back. So I give you more extra working area here. So I can get in my tray and my box. So my working area is here now. So I'm going to use this one for the female. So I'm going to put this one here. So I have an extra area. So I'm going to open all my supplies. This is sterile, and ask if the patient has iodine allergies or hydrogen peroxide. So I'm going to clean for iodine and throw it away. I'm going to open my lubricant and put here a little on my tray and throw away. I'm going to open my catheter, my Foley, and I'm going to put on the lubricant on my tray. And I'm going to start my syringe on my catheter, on my Foley. Just leave here for now. And now I'm going to clean it. I'm going to get my non-dominant hand, open the labia, and get my cottons and clean, throw away, clean, throw away, clean, throw away, clean, throw away, clean, throw away. So I have it cleaned, so I'm going to insert my catheter now. So okay, I go 2 to 3 inches in the female. Once I get some urine and I see that some urine are coming through, so I go another more, 2 to 3 inches, and I insert my normal saline. So I insert all my normal saline. I'm going to insert it, and I need to remove it so the gravity don't go back. And I need pull, so there is a resistance, so it's on place. So I can just put my bag down and remove all my working thing, all my working materials. Remove all my working materials. Again, I'm not going to remove this one because I'm going to use for my videos are school videos, so I need this for future. And now I put the patient comfortable back and I put the bed down.